our work is with the register from the Latin American bone marrow transplantation on MDS. It's a register that we have 17 centers in Latin America from Brazil and Uruguay. And we studied the 258 patients from both sexes. The patients were stratified according to the revised International Prognostic Classification System, or IPSS. And we study conditional regimen, graft versus host disease, and we look the impact of the treatment prior to allogenic transplantation in patients with MDS. And it's very important because we looked at 62% of patients, about 162, were treated before hematopoietic stem cell transplantation, and 96, about 37%, received no previous treatment. Those three previous, some of them received chemotherapy, 62%, hypomethylated drugs, 29%, and both hypomethylating and chemotherapy, about 6.8%. That's when they use chemotherapy and hypomethylated is probably in the context of using one of another or another, and they do not respond. They didn't use it together in the same time. Then, with this information, we look for the survival, the overall survival of this patient, and the response of these patients. And a very interesting thing is that when we compare treated or untreated pre-hematopoietic stem cell transplantation patients, there was no statistical difference in overall survival. It's important because in the multivariate analysis, there was also no difference in patients' death outcomes and receiving or not receiving treatment before transplantation. It's a very important point because sometimes there are a recommendation that we have to wait that the patients have less than 10% of blasts in bone marrow to go to transplant. And sometimes, in our opinion, the most important thing is to find it as soon as possible, the donor, and go to transplant as soon as possible. Then sometimes we saw in our experience patients that was waiting with the ideal situation, and sometimes they do not do transplant because they was waiting, and then we with this information we know that another group published something like this with the same results from the German group, and Marcos de Lima from Cleveland published some years ago the same results of us. We know that our study is a retrospective study, and we have some bias in this, but it's very important, and we decided to conduct our patients with this approach until we have another information.